How are y'all today? Okay. So today we're talking about injury nutrition. So we're going to be discussing injury nutrition, and primarily what I mean by injury nutrition is injuries that are going to be common with atrophy. So where atrophy is going to be an issue. So longer term injuries such as ACL repair or things like that. So we're ahead of schedule today. We're really ahead of schedule. I like Twitter, and I've talked about that every year I've presented here. And so if you want to follow along with me today, I'll be on Twitter, and that's my Twitter handle right there. I will be tweeting out as we go along all sorts of different articles, videos, infographics, blog posts, etc. that go along with that presentation. Now, I had it synced thinking we'd be starting at 2:30. However, so I'm a little ahead of the game right now. But in a few minutes, those slides or those tweets will be going out. And that way, if you're curious about anything in particular related to the presentation, you can always go back and look and see some of the additional information. So today we're going to be talking about injury and nutrition. And when we talk about it from a nutrition standpoint, we talk about it in the sense of two different stages. So we talk about it from the atrophy phase versus the recovery or hypertrophy phase. So the atrophy phase is that first 6 to 8 weeks or so, depending on what the injury is, but that's going to be the time frame where the limb is immobilized and we're more at risk for atrophy. That's going to be when we see loss of strength, reduction in metabolic rate. That's going to be when we see additional body fat accumulation, additional insulin resistance. Ultimately, my goal at that point is to help minimize atrophy, minimize accumulation of body fat, and just to support the overall healing process. So this is a helpful little graphic that gives you just a general idea. So when we see an injury, we see immobilization, we see a decrease in basal muscle protein synthesis, and we see resistance to anabolic stimuli. So what that means is essentially now when we have protein, our muscle responds to that much less effectively compared to normal when we're active. And from that, we now see overall loss of strength, loss of size of muscle, and that's what we're running into. Stage one concerns that we may not always think about from a physical therapist standpoint or from an athletic training standpoint. Pain medications, for one. Pain medications, when we run into pain medications, we're seeing lack of appetite, we're seeing nausea, we're seeing constipation. These are things that may decrease the appetite of the athlete and may prevent them from eating when their potential nutrition needs are at their greatest. Okay, food access. How is the athlete getting their groceries? How are they preparing food for themselves? Is this an older adult? Is this a young adult? When they're at home, what's their access to food? If their parents leave them at home for the day so they go to work, and that athlete is in pain, they're on a couch or they're on a bed all day long, how likely is it that they're eating throughout the day when they actually need to be? How easy is it for them to get up and go to the fridge and actually make themselves a quality meal at that point? Right? Nutrition is very vital during this injury time, and yet their access to food may be poor. So we need to figure out that and address it and make sure we have a plan to counteract that. Energy needs are definitely going to be lower, especially after surgery when they're immobilized, when they're not moving around as much. But they may not be quite as low as you would think they would be, right? If they're crunching around on campus, that takes around quite a bit of energy to do that. Overall, the goal is maintenance. A lot of times athletes think of this as an opportunity to gain weight or lose weight, right? I have no appetite, now's the perfect time for me to drop 20 pounds or 30 pounds. I'm not moving around, I'm not burning off nearly as much energy, now's the time for me to gain a whole bunch of weight because I need to get ready for a football season next year. Now is the time that we want to maintain weight. If they gain weight, it's going to be body fat accumulation. If they lose weight, they're going to be much more susceptible to loss of muscle mass. So we want to try and hold on to muscle. We want to try and maintain weight as best as possible. Muscle protein synthesis is suppressed, like we talked about just a second ago, and so for that reason, protein needs are dramatically higher. They need to be taking in 2 to 2.5 grams per kilogram of protein per day, right? That's about a gram per pound of body weight, a little more, a little less than that. Your athletes are likely not taking that in. And when your athlete is injured and on pain medication and immobilized and not moving around, they're definitely not taking that in. So the recommended amount is going to be pretty drastically high as far as protein because we're trying to minimize that loss of muscle overall. So what we'd like to see is probably 20 to 40 grams of high quality protein throughout the day at every meal. Right? So they may need to focus on protein first. When they're having a meal, focus on that protein first, and that's going to allow them to make sure they're getting their protein needs at least. All right, so we talk about this oftentimes when I come to this conference. We talk about, from a nutrition standpoint, we discuss net protein balance, which is the difference between muscle protein synthesis or the accumulation of proteins or addition of proteins to skeletal muscle, and the loss of protein, so muscle protein breakdown. Right, so what I want you to think about is I want you to think of your skeletal muscle, your athlete's skeletal muscle, as a wall of bricks. And every one of those bricks is protein. Every day you have a guy, his name is muscle protein breakdown, and his job is to break down that brick wall. You also have a guy whose name is muscle protein synthesis, and his job is to build up that wall of proteins. Muscle protein breakdown happens constantly. It is always happening throughout the day. Muscle protein synthesis is temporary. All right, so now what I want you to think about, muscle protein synthesis has a conveyor belt of bricks going to him every day. If you have a meal that has high quality protein and enough protein, then that means for that period of the day, for a few hours, you're going to add more bricks to the wall than you're losing, and so the size of the wall gets bigger. Now, what happens oftentimes is athletes have maybe one meal where that occurs, and they have 3 or 4 meals where they're either not eating at all, or they're having limited protein, poor quality protein, and so for that period of the time, or that period of the day, they're now losing more bricks than they're adding. All right, so now we're in a net negative balance overall for the day. What we also run into is when someone is injured, when someone is an elderly adult, when someone who is at a caloric deficit or trying to lose weight, now that's when we encounter what we call anabolic resistance. So what that means is you supply the normal amount of protein for that athlete, and yet their brick wall or their builder, muscle protein synthesis, adds less of those bricks to the wall than usual. So they don't get nearly the same response. So we try and counteract that by giving the body more protein. All right, we give him a greater amount of selection so that way he can add some of those bricks to the wall. All right, the quality of protein is also important. So oftentimes, this happens to me almost every day, but at least once a week. I will tell an athlete they should have protein at each of their meals. And they'll tell me, I have nuts for breakfast, or I have it for a snack or for lunch, or I have quinoa, or I have bread, or whatever it may be. Right? The quality of protein counts. So when we talk about quality protein, we talk about the essential amino acids, and we talk about leucine. Leucine is that key essential amino acid. We usually want to get at least about 2.5 grams of it in a meal to really initiate muscle protein synthesis. So to get 2.5 grams of leucine, it would take about 3,000 calories worth of bread. So the exact number was what? 3,400 calories worth of bread. So when your athlete tells you they're having quinoa for lunch and that's their protein source, no, it's not. When you tell me you're having nuts for protein, no, it's not. It's about 800 calories or 1,000 calories worth of nuts to get the amount of protein you would need to get that leucine content. Right? So we really want to focus on good quality proteins like meat, fish, dairy, eggs, whey, soy. Those take much less to get that leucine amount. So it only takes a few hundred calories worth of those to get the response that we need. Right, so this is how we might distribute it over the course of the day. So we're looking at a little bit of protein with each of our meals evenly distributed. And that will be most effective for maintenance of muscle mass during an injury. Every 3 to 4 hours. Now in that packet that Bob gave to you, there is a sheet in there. There's a 2-sided sheet, and it says Nutrition Tips for Recovery. And on the back page of it, right, on the back page, it shows you, or the second page, it shows you in the bottom left-hand corner a box that says body weight, protein, carbohydrates. And underneath body weight, there's different ranges of weights. And underneath protein, there's different numbers. So it says a 150-pound athlete, 160-pound athlete needs about 3 servings of protein. And that top right-hand corner, there's a list of all sorts of protein examples. So it says 1 egg, or 1 ounce of chicken, or 1 cup of milk, or 1 string cheese. Now, what that means is that your athlete, you find their weight, number listed next to them, so 3 protein servings, and they need to get 3 examples from that list in any combination every meal. And that is the minimum they should be getting. That does not get them to 2 to 2.5 grams per kilogram, but at least gets them much closer than many of them are doing. Right, so for breakfast, if you looked at it, my athlete's 150 pounds, it says they need 3 protein servings. I scroll up there, I see 1 egg is 1 protein serving. That means I could have 3 eggs to get my 3 servings, or I could have 2 eggs and a cup of milk, 2 eggs and a string cheese, any combination, but you need to get that amount each and every meal. Right, and that's healthy athletes, injured athletes, etc. Simple goals for them to work on. Okay, other things that we can look at. Omega-3 may be helpful, and not because it's anti-inflammatory properties, but what we have seen is in a few studies done on older adults, muscle protein synthesis is suppressed due to that anabolic resistance that we talked about earlier. And so there are a few studies that have been done in older adults where omega-3 was supplemented, and the response for muscle protein synthesis increased. Right? So they were basically sensitized to that protein. It's been done in older adults, and a few studies in younger adults have been effective as well. So it may be potentially helpful in injured athletes. There was one such case study done where they supplied 4 grams of omega-3 every day, and they saw a decrease in atrophy for that athlete after an ACL reconstruction. Okay, alcohol, on the other hand, would decrease muscle protein synthesis. It would not be helpful, so we want to avoid that. Okay, vitamins and minerals, oftentimes athletes will supplement with antioxidants or things like that, not been shown to be effective. Okay, however, vitamin D came up yesterday. That was a question that came up. Vitamin D deficiency may be possible. So we know some athletes are more at risk, such as those who are elderly, obese, dark skin color, indoor athletes, or athletes that are training during the winter time. Right, those are times where we're at risk. The sources of vitamin D are going to be things like sunlight, fatty fish, vitamin D fortified dairy, etc. Okay, sunlight needs to be direct skin contact or direct contact, meaning that you can't have your extremities covered, you can't have your legs covered. Right? I always joke around. One of our physical therapists in the Woodlands was telling me that she was shocked and appalled that she was vitamin D deficient. Right? She trains before sunrise, wears Lululemon leggings, wears long sleeve Nike warm up, right? And she runs in the Woodlands, which is heavily wooded, right? Lots of shade in the dark. Shocked that she was vitamin D deficient. She was getting no sunlight, right? So she may be more at risk. So your athletes that are training indoors or during the winter time may be more at risk for vitamin D deficiency. And when we run into that, it's not just bone health, but it's also muscle weakness, muscle pain, and soreness has been symptoms of vitamin D deficiency, along with poor bone mineral density, etc. Okay, so we do want to address it. Now, the question came up yesterday, should we test all athletes? And there's a good article and a good video that I'm posting on Twitter that talks about there are some questions coming up in research now that we don't necessarily know what's the best way to measure vitamin D. That perhaps not all athletes should be tested the same way. So black athletes are very notorious for having low vitamin D status. However, the question is coming to play that African American athletes may not be or may not have that measurement as the best measurement. So 25-OHD may not be the best source or best form of measurement for vitamin D status because some races, some ethnicities tend to be low no matter what, and yet their injury risk is not necessarily higher. So the question is coming to play is that actually the best measurement for vitamin D status? So I think there's more to come on that. So I don't know that we necessarily have to measure any and all athletes because you likely will find that a lot of them are going to be vitamin D deficient, whether that's actually impactful or not. Okay, as far as vitamin D goes, this is one study that did show an effect. So they showed that those who had an ACL reconstruction, they measured their force on a horizontal plyo press. They did that 2 weeks before surgery, and they did that 3 months after ACL reconstruction. And they compared 2 groups, those who were vitamin D deficient and those who had normal vitamin D status. And there was a 4-fold difference between the 2 groups. So those who had a normal vitamin D status improved 4 times more than those who were vitamin D deficient. Okay, questions that we can ask our athletes to help address these things. One is, how is your appetite? How does it differ from when before the surgery or before the injury? Are you able to finish your meals? How many meals a day are you having? Right, trying to start with that. So if they're having 1 or 2 meals after their surgery, they should likely be having 4, 5, 6 meals a day. Right? Are they able to finish their food? Okay, no, well, they should be starting off with a protein source. So we want to think about some of the simple things. Let's get enough meals in the day. Let's get a protein source in each of the meals. Let's get some good quality foods in there. Right, so this is ultimately what our meal might look like. Right, so good quality protein, plenty of color, and a little bit of starch to go with it. Right, so ultimately, we want to, in that first phase, maintain weight, reduce energy intake, maybe just a little bit, and we want to do that by reducing carbohydrates and reducing fat. We want to increase protein intake, and we want to take in at least 20 to 40 grams at each of our meals. Incorporate plenty of color into our diet, and there may be some benefits to omega-3 supplementation. Potentially, we may want to think about supplementing with vitamin D, about 2,000 international units a day, especially during wintertime or those who are more at risk. That might be the key number that we're looking for. Okay, during that hypertrophy phase or that rehabilitation phase, so now they're starting to do more aggressive training, aggressive therapy. Now we know their energy needs are going up. They're starting to be more physically active. So we want to support those energy needs. We want to make sure that we're taking in a little bit of additional carbohydrates now to help support the training. Protein actually goes down. So now there's less anabolic resistance. Their muscle is much more responsive to protein, so we don't take in nearly as much. We may need only as much as 1.6 to 2 grams per kilogram relative to, or compared to 2 to 2.5 grams per kilogram. So protein overall goes down just a little bit during that injury or that phase. Now might be the time where creatine supplementation may be effective. So during that immobilization phase, creatine has not been shown to be effective in decreasing atrophy. But now might be the time, just using logic from some of the other studies that have been done with healthy athletes, right? Creatine may be helpful for hypertrophy at this point. Okay, and then lastly, we want to make sure that we're emphasizing therapy recovery. Asking questions is very crucial. I've had athletes recently where they were having no breakfast, going to school all day, didn't like what school lunch was provided, going to therapy or physical therapy at 2:30, 3 o'clock when they got out of school, and had not eaten yet. Right? And now they're trying to build back muscle mass after an ACL reconstruction. All of you know that's not logical, right? But no one had asked that question. No one had addressed it, because that's not what we as physical therapists do. That's not what we as athletic trainers always do. I know y'all are doing it quite a bit, right? But we have to ask those questions to try and stay on top of things. Right, so now we go back to that handout. I didn't reference carbohydrates earlier, but now would be the time where they're starting to train more aggressively. Now you can factor in carbohydrates as well after therapy. Right, so after therapy, how much carbohydrates should they have? You find their body weight, you find the amount of portions that they should have, and that's your portions for that particular meal. So again, questions. So how's your energy been during physical therapy? How many meals are you having each day? How's your appetite overall? Are you able to finish those meals? Right. What are you having after physical therapy? Right. If they're trying to do therapy and they're always exhausted, then that's not very effective. If they're not eating beforehand, if they're not eating after, that needs to be addressed. Right. So you want to ask those questions to help try to determine what their nutrition needs are, what their habits are overall, and how we can help. Right, so this is how we might summarize it in a visual form. So now we're doing a little more physical activity, so we want to increase the amount of starch that we're having. We want to decrease the amount of color we're having just a little bit, because now we're expending more energy. Right, and we're still having a good quality protein source in each of those meals. All right, so I wanted to bring up one last kind of unique thing. So there's a a new study that's come out in the last year out of UC Davis, where I'm curious if this could be something potentially used in the future. Right, so the question has come up that we know that strength of bone, ligaments, tendons, cartilage is linked to the amount of collagen found in them and the cross-linking of that collagen. Okay, so if we could increase collagen synthesis, could we increase the stiffness and the strength of those the ligaments, bones, tendons? Could we make them rehab, or could we prevent injury a little bit better by doing this? Right? And could we decrease rehab time by doing this? Okay, so a group out of UC Davis did a study where they supplemented with vitamin C and gelatin. Vitamin C and gelatin. So they did a randomized crossover or randomized control trial with a crossover design. So they took one group and they supplemented them with a placebo, with 5 grams of gelatin, and with 15 grams of gelatin. And they had them do jump rope 1 hour after that supplementation. Okay, then they measured 3 different things. So the first thing they measured, they took the cells of an ACL and they created their own engineered ligament. And there's an interesting video on this that I'm posting as well, and you can look back and see just how they make this engineered ligament. They put this engineered ligament in a petri dish. They then supplement the groups with either the placebo or the gelatin, and then they take a serum draw 1 hour after that supplementation. Right. Then they took that serum and they fed that to that engineered ligament over the course of a week, and they measured just how much collagen was found in that engineered ligament. So they showed that cross-sectional area stayed the same, but the percent of dry mass of collagen increased in the engineered ligaments in a stepwise progression. So placebo, before anything was taken, right, versus 5 grams of gelatin versus 15 grams of gelatin, we saw a greater increase in collagen in those engineered ligaments. The second thing that they did is they measured how much or when did certain amino acids peak in the blood. So the idea behind this is that there are certain amino acids that are found in collagen. And all those amino acids are also found in gelatin. So if we consume gelatin, at what point would those amino acids peak in the blood? Now when someone does physical activity such as jump rope, they're loading the tendon, they're loading the ligament, they're loading the bone. Those ligaments and tendons are avascular. So that means that they're getting very, very minimal blood flow to them, and they act like a sponge. So they soak up those nutrients that are available to them for a very brief moment. So what you're trying to do is when that activity is initiated, you want those amino acids to be at their peak. And when that happens, now collagen production or collagen synthesis would be at its greatest opportunity. So they measured 30 minutes, an hour, hour and a half, 2 hours after, and they saw that ultimately that collagen or that those amino acids were at their peak 1 hour after supplementation. So that now tells us that if we were going to use gelatin as a supplement, we would want to take that 1 hour prior to that activity. The last thing they did is they measured a marker of bone metabolism, and they were able to show that bone metabolism increased with that gelatin supplementation. So when they supplemented with 15 grams, that marker of bone metabolism went up dramatically. So now the potential is, could we supplement in an injured patient? Could we supplement to prevent injuries? Right? So now that question comes into, perhaps if we were, the suggestion is we would take that gelatin 3 times a day, 1 hour before physical activity, if they were an injured athlete, or 1 hour or 1 time a day for injury prevention. The example exercises they talked about are jump rope for lower extremities, or things like a rice bath or throwing program for something that's an upper extremity like a pitcher, etc. Right, so this is an infographic, I think that's also in your packet as well. That talks about the gelatin study, it talks about the protocols of it, and it explains the process of it. Right? And a lot of questions come up with, okay, so what does this actually mean? So this is one comment from the researcher. And he was asked, okay, so just in layman's terms, what does this mean? So if you broke a bone and you supplemented with 15 grams of gelatin plus vitamin C, followed 1 hour later by 6 minutes of loading, and you repeated that process every 6 hours, the recovery time would be shorter. Right? That's ultimately what the study is telling us. So this is a unique idea, and it sounds funky and weird, but it is being used. It's being used at the collegiate level when you speak to college sports dietitians. It's being used at the professional level. It's being used by USA Track and Field. I think it's a little bit new. It's obviously a novel idea. The researcher has done a few studies out of the lab that are unpublished, and they've done this one published study, and now they've got some more under works right now. Right, so I think it's something to keep an eye on, that potentially this could help with the rehab process and could help with injury prevention in general. Right, and this is one other handout that's also on social media that I'll post as well, but this is just a handout of the recipe. So if you were going to do this, if you were going to experiment with it, and the lab itself or in the study itself, they drank the gelatin, which I've done before, and it's awful. It's a terrible experience. Right, coagulates very, very quickly and tastes awful. But if you wanted to make it into an actual gelatin, then this is a recipe on how you could do that with juice just to get the right amount of vitamin C, right, and the gelatin itself. Right, so we don't need to supplement with a heavy dose of vitamin C. We're just simply taking a little bit of juice that has some vitamin C in it, like apple juice or something like that, or orange juice. And we're taking a little bit of water and we're taking the gelatin and making it into an actual Jell-O. Okay, that is my information again, if you have any questions at all. Any questions for today?
Right over here.
And the researcher said that it would shorten the recovery time by doing these Jell-O shots.
Yes. Yes.
What, shorten it by how much?
That's a good question. I don't know. So the question was how much, so would it shorten recovery time? So, right, that's what the statement that researcher is making. And he's making that statement not based off of he took an injured athlete and compared two different injured athletes. He's basing that off of his marker of bone metabolism. That's where he's getting that information from. Right, so now would it shorten the time, and by how much would it shorten the time? Now, we don't know that. Right, so that would be, as they do more research on this, does it actually really work? Right, so let's repeat the study several times. Let's try different amounts of gelatin. Does the body, does lower body versus upper body matter? Does the size of the athlete matter? We need to find those things out first, I think. Right, and then the question is, trying it, yes, do we shorten recovery time on a similar injury in one group versus another? I think that would be interesting to see. Yes? Thank you, Trevor. So Trevor's not on social media much, but I did see him repost a study today, so he decided to bring this up. So branched chain amino acids are essential amino acids, right? But there are more essential amino acids than just the branched chain amino acids. Branched chain amino acids are leucine, isoleucine, and valine, right? And so when people oftentimes will supplement with branched chain amino acids to help build muscle, and they did a recent study where they compared branched chain amino acids versus placebo and showed that there was an increase in muscle protein synthesis in the group that supplemented with branched chains alone. Right? But then they discussed in the discussion how much dramatically less that was relative to a complete protein like whey protein powder. So when we stimulate muscle protein synthesis, we need leucine, which branched chain amino acids are made up of. But we also need all those essential amino acids. So leucine is the trigger, and those other essential amino acids are vital to maximize muscle protein synthesis. So you don't want just branched chains, you want the whole protein. So it's not effective to supplement with just leucine, not effective to supplement with just branched chain amino acids, much more effective to supplement with a whey protein or just a whole protein in the source or form of eggs or dairy or things like that. Did I answer your question, Trev? Thank you. Any other questions? All right. Thank you for having me, guys.